In China, they did the work we did in Europe in 30 years, probably.
One of the best examples in recent times is China, where we've seen between somewhere around 2013, when they started enacting large-scale clean air action plans, to now, there have been substantial reductions in air pollution levels.
They have been able to dramatically decrease air pollution through combined efforts that span municipalities and cities. There were a number of policies instituted over the last decade after they experienced some very, very high and very well publicized air pollution episodes. These included things like working on banning coal for heating in rural areas outside of Beijing, thinking about reducing traffic and cleaner sources of transportation. And from a transferability standpoint, I think those policies may be transferable.
In 2015, as part of a multi-pronged approach to improving air quality in China, the Beijing government launched a coal to clean heating policy. So this is a policy that banned coal burning, and then at the same time that they banned coal, they would provide a subsidy for an electric heat pump and the cost of electricity. And so, in the way that, China does exceptionally well, they implemented this in millions and millions of villages. So enormous impacts of this policy across northern China. And what we wanted to do with collaborators at Peking University and the University of the Chinese Academy of Sciences is evaluate whether or not this policy was actually having its intended impacts on air quality and health. Actually, the first thing that's maybe the most interesting is that the policy was highly successful. So we saw a dramatic reduction in coal burning, so basically about a 98% reduction in coal burning. High uptake, people loved the intervention, so they loved the electric heat pump technology, even though it was actually a bit more expensive than coal with the cost of electricity. They used it, their homes were warmer, so they had the villages that went into the policy had warmer homes. Indoor pollution was less, and we saw a blood pressure benefit and also a respiratory benefit. So overall, I think there's really good evidence to indicate, at least from our studies, that this policy provided both an air pollution and sort of, a well-being benefit from having a warmer home, but then also having, a health benefit or a measured health benefit as well.
So that is one really good example that progress can be made if you dedicate the right resources, data sets, and policy decisions to it.